Metastatic cancer in a 64-year-old female. Patient history. The patient has 3 years of gradually emerging mass at her left breast. Chemotherapy was done 6 times. Initial diagnosis: invasive ductal carcinoma, stage 3A, left breast, and chemotherapy 6 times. After the surgery, specimen was sent directly to the laboratory. Gross description shows breast parenchyma measures 18.0 by 18.0 by 9.0 centimeters. Skin lips measures 16.0 by 17.8 centimeters. Nipple measures 1.1 by 1.5 centimeters. Axillary tail measures 10.5 by 5.0 by 3.5 centimeters. Seen lateral to the nipple is a gray, thick, depressed skin lesion. The dimples measure 4.0 by 5.0 centimeters. Likewise noted in this area is previously incised wound, which leads to an underlying irregular tan-brown solid mass measuring 3.8 by 4.2 by 4.8 centimeters. Tumor is seen 5.5 centimeters from the superior margin, 5.5 centimeters from the inferior margin, and 10 centimeters from the medial margin, 5.4 centimeters from the lateral margin, 2.0 centimeters from the depression and involving the interior margin of the skin. Tissue blocks labeled as A1, A2, and A3 represents the mass, A4 represents the mass in the skin, A5 represents the nipple, A6, A7, and A8 represents the lymph node, and A9 represents the deep margin. Final diagnosis: modified radical mastectomy, breast, left, invasive ductal carcinoma, poorly differentiated with skin ulcerations. 7 out of 7 axillary lymph nodes positive for metastasis with extracapsular extension. Unremarkable nipple, surgical margins clear. Remarks: tumor size measures 4.8 by 4.2 by 3.8 centimeters, and there is a presence of a lymphovascular and perineural invasion. Pathophysiology: invasive ductal carcinoma. Invasive, also known as real cancer, can spread or invade the surrounding breast tissues. Ductal, which means that the cancer has begun in the milk ducts, which are the pipes that carry milk from the milk-producing lobules to the nipple. It can spread or invade the surrounding breast tissues. Carcinoma: any cancer that begins in the skin or other tissues that cover the internal organs. Invasive ductal carcinoma, also known as infiltrating ductal carcinoma. It refers to the cancer that has broken through the wall of the milk duct and begun to invade the tissues of the breast. It can spread to the lymph node and possibly to other areas of the body. Differentiation: it is a grade of cancer which is based on the degree of abnormality of the cells observed. Poorly differentiated, high grade, cancers tend to grow and spread faster. Staging of the cancer: stage 3A, no tumor is found in the breast or tumor may be in any size. Cancer is found in 4 to 9 axillary lymph nodes near the breastbone. Lymph node involvement: extracapsular extensions, which means that the cancer is spread outside the wall of the node. Surgical margin: rim of normal tissues around the breast. Clear, aka negative or clean. No cancer cells are seen at the outer edge of the tissue that was removed. Unremarkable nipple: no morphological changes or cancer cells are seen. Metastatic breast cancer, also known as stage 4. In this stage, Breast cancer is spread to other parts of the body like the liver, brain, bones, or even lungs. Cancer cells has traveled through the bloodstream or lymphatic vessels. Vascular or lymphatic vessel invasion. This happens when the breast cancer cells break into the blood vessels or lymph channels, increases the risk of metastasis. Perineural invasion, also known as PNI, is a sign of aggressive invading cancer cells. The perineurium is a connective tissue sheath surrounding each bundle of nerve fibers in a peripheral nerve. To sum it up, the 64-year-old female patient who had undergone modified radical mastectomy on her left breast was found out to have stage 3A invasive ductal carcinoma, or the cancer that originates from the milk ducts, with poorly differentiated or high-grade cancer that is fast-spreading. The patient's specimen was also noted with skin ulcerations. 7 out of 7 axillary lymph nodes were positive for cancer cells, or termed to as metastatic, with extracapsular extension. Nipples do not show any abnormalities or cancer cells. The surrounding tissues of the specimen or the surgical margins also do not contain any cancer or abnormal cells.